Menstrual cycle is the process by which the female releases one mature egg from the ovary. One cycle is about 28 days on average. It can be between 21 days and 35 days. If your cycle is between 21 and 35 days, then you're normal. Menstruation comes about due to the changes in pituitary hormones and ovarian hormones. Pituitary gland produces two hormones that are involved in menstruation, that is follicle-stimulating hormone and luteinizing hormone. First 14 days pituitary gland produces follicle-stimulating hormone, which stimulates egg production from the ovary. Follicle-stimulating hormone stimulates production of estrogen. Next 14 days, luteinizing hormone is produced, causing ovulation. Luteinizing hormones directs production of progesterone. Estrogen and progesterone produced from the ovaries ensures thickening of the endometrium wall of the uterus. What happens to the ovaries during menstrual cycle? Ovary undergoes 4 stages. We have a pair, but only one ovary is involved in one cycle. Stage 1, ovum begins to develop in the ovary. Stage 2, the egg continues to grow as the follicles grow. Stage 3, egg burst out of the follicle. Stage 4, egg enter the fallopian tube. As the ovary is undergoing changes, also the uterus walls are undergoing changes. From day 1 to up to day 5, shedding occurs. Day 5 to day 14, there is proliferative phase. The walls of the uterus continues to thicken slowly. Next 14 days is secretory phase for the uterine wall. Uterine wall continues to thicken as more glands are developing. What is said to be normal according to menstruation? On average, most girls begin menstruation at the age of 13 years. In most women, menopause comes at 51 years. Not every woman has a normal cycle, some have disorder. If your menses comes before 21 days, it means you have polymenorrhea. If it comes after 35 days, you have oligomenorrhea. If you bleed more than 7 days, you have menorrhagia. Irregular menstrual bleeding is called metrorrhagia. Absence of menses is called amenorrhea. Pain during menstruation is not normal. It is called dysmenorrhea. Below are some causes of abnormal uterine bleeding. 1. Abnormal uterine bleeding can be due to reproductive diseases or emotions and stress. 2. Some systematic diseases such as disorders of coagulation, endocrinopathies, liver failure, and obesity can also cause abnormal uterine bleeding. 3. Did you know also some medications can cause abnormal uterine bleedings? Also, some hormonal contraceptive can cause abnormal bleeding. 4. Some reproductive tract diseases such as polyps, fibroids, carcinomas, and infection cause abnormal uterine bleeding.